Hello, and thank you for coming to hear my presentation. Today, we're going to learn about the effects that sugar has on the body and some of the long-term consequences that come along with overconsumption. Everyone loves sugar, so it's important to understand the potential dangers that come along with it. Sugar consumption comes in many forms, including soda, candy, juice, cereal, and a variety of common household foods. Most people are painfully unaware of the amount of sugar they eat, as it's in every piece of processed food from the grocery store. From an American standpoint, we're raised to crack open a 7 Up whenever our tummy hurts. Author and researcher of American Obesity, George Bray, and his co author, American nutritionalist Barry Popkin, state in their peer reviewed journal that Americans' consumption of sugar was minimal near the birth of America and is now at unforeseen levels. They state that Americans, on average, consumed 4 pounds of sugar per year in 1776, and by 1994, that level was nearly at 120 pounds of sugar per person per year. This overconsumption has led to a spike in obesity in the 1980s and is still trending today. Obesity can lead to a number of issues in the human body. Most commonly, these are heart disease and type 2 diabetes, as well as ailments such as painful joints and knees. Erosion of the teeth is also a first-hand side effect as well. As a member of the medical community, I see the effects that sugar-induced diabetes produces firsthand because I work for an optometrist and I perform diabetic exams every day. Those exams always include the patient's eyes being dilated so that the doctor can get a better look of the retina and check for any changes. Unfortunately, it's very common to come across patients who have diabetic retinopathy or bleeding behind the eyes due to diabetes. You see, our bodies are all connected by blood vessels, and those vessels act as the plumbing for our bodies. When the plumbing in the bodies gets blocked, leaks happen, and that's what diabetes does to the eyes. Those with severe cases of diabetic retinopathy can go blind and have to live a life of darkness. The other side effect of the overconsumption of sugar is heart disease. Scientist and nutritional researcher at UC Davis, Kimber Stanhope, states in her article that the consumption of excess sugars can lead to an increase in unfavorable lipid levels, insulin resistance, and fatty liver. Those combined may lead to metabolic diseases, which cause dysregulation of lipid and carbohydrate metabolism. When your metabolism is disrupted, it takes your body longer to break down food, which causes weight gain. This, in turn, may lead to heart failure or stroke, which would completely compromise your body and its functions. All in all, sugar or excess sugar can only cause harm to your body, and one must pay close attention to the information that's on the labels. Try to stay away from added sugars and ask yourself if you really need that soda or candy bar. Sugar is a slippery slope like most addictions, and it can easily lead to a lifetime of health problems and complications. So it's important to educate everyone on the dangers of sugars starting at a young age. We must be willing to fight for our health because good health is the most important thing that one person can have. All right, well, that's it. Thanks for coming to hear my speech today on the effects that sugar can have on the body. I hope you learned a lot and you'll be a little bit more mindful in your choices on the fuel that you feed your body. I hope you have a great rest of your day. Bye.